welcome to another episode of the Atlantic CIL podcast. I'm your host, Donald Campbell. I'm here with Diane. Diane, how do you say your last name?
Conover.
Conover. And
Mhm.
we're going to talk about important topics in the disability community, which of course that's what we're all about here at the Atlantic CIL and the Atlantic CIL podcast. But really talk about dementia and also other disabilities that affect our population that I sometimes think go under discussed. So, Diane, let's start with you. Tell us about your background and then we'll get more into specific topics.
Well, thank you for having me, Don. I'm actually an RN by licensure, and I work for a long-term care and subacute rehab facility. It does have a dementia unit on it, but I've been working with senior care for the last 28 years. I now my own target audience because I'm a senior now. But that journey took me into a lot of Alzheimer's, dementia. Personally, my mother had dementia and I got involved that way. And I do work with the Alzheimer's Association and the Walk. I facilitate a support group on the first and third Wednesday of the month in Mays Landing for caregivers of people with dementia. And we use the broader term of dementia. Alzheimer's is one of the specific types of dementia, and there's many. So we do have a very good group, and there are other resources available around, but it's something we don't discuss. It's something that people are afraid to talk about. And it's very real. 7 million Americans will be diagnosed with dementia this year. 7 million. So it's a large number, a very large number.
Yeah, and it's really important. And like you said, there's still stigma around it. And I know that's something we're really big on here in the Atlantic CIL and our podcast is really breaking down the stigmas around different disabilities because it really prevents people from getting the care and the support they need because people don't want to discuss it. And so can you tell us, let's really define these terms because people throw out, as it probably drives you up a wall sometimes, people throw out these terms all the time. So let's define kind of dementia and Alzheimer's, how they're the same, how they're totally different. Because I
Well,
always feel like people like they know enough to be dangerous sometimes and they kind of perpetuate this stigma by saying certain things. So talk about that.
so anyhow, the so everybody got very used to the name Alzheimer's because there's such a large drive for fundraising and cure and all that. But Alzheimer's, dementia is the overall umbrella, and you may have frontal temporal lobe dementia, like Robin Williams have. You might have Wernicke's, which a lot of times comes after prolonged drinking, and then can even surface later, even if you have quit drinking. So there are all different kinds, and some do manifest. Louis body dementia manifests paranoia and a lot of times visual hallucinations. It might manifest itself in a way that's a little bit different. And it's very hard because we go from what's normal aging and forgetting and what is dementia. And the statistic is that within 24 hours of diagnosis, we take away 75% of their independence. So immediately, oh, they have dementia, they're not going to remember anything. I'm going to do this, and this. And it really progresses the progression of the disease because they no longer are making those decisions. So that's kind of the difference. It really does there needs to be a good physical exam from a physician prior to anybody looking into the cognitive area. There is not a whole, there's Penn Memory Center is excellent. There are some really great neurologists in the area. However, your traditional family physician usually does not have the tools in their toolbox to really help you and to diagnose this. And it is life altering, and it alters the way you thought the end of your life would be with your loved one if you're the caregiver, because all of a sudden you're not having that fairy tale happy ending. It's hard work. So that's kind of the differences. And there's many, and there's great resources out there, especially the website alz.org, alz.org is put out by the Alzheimer's Association. There's some really good events and community education going on in the area, and all that is listed through there or on different websites.
Yeah, and you can send me websites and I will put them in the description of our podcast of this episode so people can
Okay.
click. I think that what you just said really stuck out to me about how, because believe it or not, at the Center for Independent Living, we're all about independence and for people with disabilities. And what you just said about within 24 hours of diagnosis, 75% of we take away 75% of the independence of the individual. And talk about, you were spoke a little bit about how that's really detrimental to the diagnosis and to the person. So
So the brain
talk about
slows.
that. Yeah.
The neurons don't fire as quickly. So what we tell, there's two different things that I've heard. What we tell people is when you speak to someone, when that's starting to progress, you need to give them time to process the information you're giving them. You can't just go, okay, now we're going to go to the car, now we're going to lunch, let's go, let's go, let's. You can't do that. We're going out today. And they won't remember. The further back the memories, the more they remember them. The more current the memories, the less as this progresses. So say it's something as simple as brushing their teeth. You can't say, come on, it's time to brush your teeth now. It's more, we have to get up and go to the bathroom to brush your teeth. And then you have to give them some people say 19 seconds and some people say a minute and a half. And that's a long time.
Yeah,
If I said to
that's
you,
two different ends of the spectrum.
yeah, if you're having a conversation and I say to you, it's time to get dressed. 1, 2, 3, 4, 5, 6, 7,
Yeah.
8. See what I mean? And that's just your normal routine conversation. And that is one of the hallmarks of how to maintain some type of conversation with them because they'll just shut down. In the beginning, so many people say, they knew something the loved one would say they knew something was wrong. They just couldn't process it. My mother used to take notes. So she knew enough. She had vascular dementia, which is that from the narrowing of the blood flow to the brain, to pick up the notepad to say, like, oh, did your daughter have that test on Friday? But she didn't know enough to remember that she had a test on Friday.
Right.
And so it's processing, it's giving them a choice, but still maybe limiting the choices. You can't open up a closet and say, what do you want to wear today? You can put out 2 outfits and say, do you want the blue one? Do you want the red one? And then there's also different physical things that manifest as things progress. It's still a fatal disease. There's no cure. There's research being done, but it is still fatal. The life expectancy has increased because we're diagnosing it earlier.
Right.
People are having these concerns. And we do tell people if you have concerns with your loved one and you're going on that routine doctor's visits, write it down because it upsets people. If you say, I think you have dementia, well, demented people put that back to mental health wings and the wards. And, demented has a horrible connotation to it,
Right.
horrible, and I think one of my prior support groups, I had a gentleman come in and he said, I know what I have. And now I know I need to know what's going to happen to me. And there's no clear path. You can be in between one stage to another, but in the end, it is fatal. And it is very difficult to deal with. 7 out of 10 people will wander. And I've sat in these different support groups. I've actually had support groups now in different venues for probably 10 or 12 years. And, this woman, my husband's fine. He's fine. He's fine. I leave him just to come here for an hour. And then one day she went home and he wasn't there. And she called the police. They said, oh, well, we know where he was. He was in the middle of the parkway, walking down the parkway.
Wow.
So it's not a question of will they, it's a question of when.
Right.
So in these groups, we go over the security procedures and the procedures for them. And it's the cost of dementia. It's $360 billion a year right now in our nation. They're saying that within a few years, they'll be up well over $1 trillion. And a lot of it is unpaid caregiving. It's family members. And it's hard. I mean, there's tricks and tips to learn by going to different support groups, and there are different support groups in the area at different times. And there are some that are virtual, so you can just get on a Zoom call and find it that way. But there's a couple of tips and tricks, but it's not going to get better. And I think that's what breaks my heart is that people come in and want it to be better. And you lose them before you lose them. I had somebody say to me facetiously, well, now your mom will never watch reruns on TV again. And my heart was broken. I just couldn't even speak to that person. When do you take away a driver's license? When do the things that people don't think of, like you need child locks in your car so they don't get out of your car,
Right.
all these safety features. But it is, again, and it's such a disability and disabling to the caregiver because you need to have eyes 24/7. There needs to be little contact alarms on the doors. There's, you need to be present at all times, or someone be present. And, especially older couples where they've pledged to love and cherish and honor for the rest of their lives. And then that life doesn't look anything like you thought it would.
Right, right. And now the whole dynamic has changed.
Mhm. Yeah. Yeah.
Everything is different than what you've expected. Talk about more about that stress on caregivers and
Mhm.
sort of the limited resources that are out there sometimes and what we can do that would help. Maybe is there anything that would be better? Any
Well,
change?
there is. The Atlantic County has graciously given a large grant to Caring Incorporated in Pleasantville, and they do have out in Mays Landing a daycare. So they pick them up if you want, and they're there from like 10 to 2. They bring them home, and this is not income based, and that's a lot of the problem. A lot of things are income based. Yourself, like even if you're going to work on the Medicaid program, you need to have certain insurances in order to get additional home care, which is only additional. It's not 24/7. But that is, right now, that's one of the most shining stars. And Caring also has a program that it's just a companion that will come in and sit with them and watch TV for 2 hours a week so that you can run to the store. Or one woman, her mother shadowed her so badly, like she couldn't even go to the bathroom by herself, that she went in and took a nap or read a book just to have
Wow.
alone time. So that is out there in our community. There are other adult daycares out there. Problem being is that some of them cannot give medications and they're there all day. Or if they are agitated in any way, they cannot have them in that program because they can't affect the other people.
Right.
And then the guilt, the caregiver guilt of, well, she told me she doesn't want to go back to the place, or he told me he didn't want to go back. I
Right.
mean, I had one woman that very thoughtfully said to her husband, "Are you going to work?" So he would get on the bus and he would go to work. But if she put him in the car and try to take him there,
Right.
so, there is that, and things do change. So I have had people go there and they were inappropriate for that point in time, but then they did get calmer, or the situation changed, and then they did accept them. It's so much of it is private pay because of the hours involved. And that's the one thing. I mean, the Alzheimer's has a small grant, a very small amount of money that you can apply for every once in a while. There's a big, and I'll send you this too, called the Seminar by the Shore, that there is a cost for, but there's scholarships available or money available. And it's going to be September 26th over at the Convention Center. It's there every year, and there's a lot of speakers, and you choose your topic. You can come and there's somebody that's doing more the medical and the what they're working on the medications and that type of thing. And then there's some that are more just about behaviors and stuff like that. You can bring your loved one with you, and they have free daycare that day for your loved one, and you can enjoy these conferences. And that again is September 26th. It starts at 8:30 in the morning. I believe it ends around 4. There's a keynote speaker. There's a lot to consider when somebody gets dementia. It not only affects the brain, it affects the body. So you start to shuffle. So, there needs to be a good look at the throw rugs, anything in the house, and you can usually get a PT, a physical therapy eval for that. Anything with a pattern they think is a hole and that they're going to fall down it, and you'll watch them stumble. If you have a rug that's very patterned, they'll get to a certain area and they might want to stumble because they think that it's a hole. Their vision gaze also goes downward. So everything has to be lowered. Like I know people that have put pictures, like if this is your underwear drawer, they put a picture of the underwear on it for as long as they could still get that out
Yeah.
themselves. Or they would put a picture of the bathroom in front of the bathroom. In my facility, sometimes there's a big picture of their name outside their room, or a memory box with things that are specific to them, not our building, but other people have done that in memory units. It's very for the caregivers. If you go through Medicaid, you can get a 5-day monthly respite usually to give you a break and have them placed somewhere that has a dementia unit that is secure and that they're used to working with people with dementia. And then there was a lot of work, and then the pandemic hit on dementia friendly towns. And what that was going to be is, say you'd go into ShopRite, dementia and any type of disability,
Right.
there'd be a certain checker that could check out more slowly than the other ones because they are rated on how much they how quickly they can process somebody. But you can't do that with somebody with dementia. Or restaurants that would know. We do hand out cards that say, please be patient. My loved one has dementia. So if they're out at a restaurant, if they're out in the store and there's some odd behaviors, you can hand this business card to somebody and they'll know that this person has dementia.
Yeah, I was gonna ask. You covered so much there, it was really good. We've got a kind of three questions. You talked about sort of how so much of it is private pay, and I think that is big
Mm-hmm.
in all the disability world. I always hear about caretaking, like, oh, doesn't Medicaid pay for that? Or
Mm.
care? And I'm like, not as much as you
You
think.
think,
Not
yeah,
as much as you think. Like, there's this component over here, and maybe there's this component over here, but I know, like, I hear all the time, like, oh, can't you just have Medicaid pay for that? I'm like, no, that's all private pay. So
yeah.
talk a little bit about that gap that exists and like what people can realistically expect from resources like Medicaid and Medicare.
Well, again, if if you're lucky, sometimes insurances will cover 5 days a week for a couple hours a day, and it's caregiving. It's a nurse may come by every few weeks to update, make sure everything is going well. Some people, it is a terminal illness, opt for a hospice benefit, which is under your Medicare, and that's one thing everybody thinks that Medicare is,
Yes.
and they only
I
cover the
lived that world
nursing.
with you too. Yes.
Yeah.
Yeah.
So, hospices give you, depending how far along the process you are, but they do give you more hours. Still, maybe it's 3 a day. You still need to supplement that. So, in that, and it's awful that this sounds so negative, but I do work in the long term care industry. And I'm very blessed that in my facility, the number of Medicaid patients does not count. But you do need to protect yourself. And I deal with families all the time that say, if I save this money for my kids, I don't want to spend it in a nursing home. I don't want to spend it on this. The reality is, then they're taken care of. And it's a hard process, but there is a huge gap. And we always tell people that get professional help. If there is funds involved, or home involved, call an elder care lawyer. It's usually elder care. I mean, there is young set Alzheimer's, young onset, but it's like going to a car dealership. You're not going to go to the Volkswagen dealer to buy your Cadillac. You go to the
Yes.
Cadillac to buy your Cadillac.
Exactly.
Yeah, and they are very knowledgeable. There's not a whole lot. There's different trusts and things that can be
Right.
set up, but nobody's going to hide anything. And there is a 5-year look back with Medicaid.
Thank you so much
Right.
for saying that. Yes.
Yeah, and it's about if any time you spend right now, it's about over $800. They want to know why. And so I tell anybody, if you're going to go buy that wedding present for your granddaughter, buy her a TV she can return. Don't just hand her cash, because then that becomes what they call a penalty. And you have to stay at home until that money is spent per capita that it would have been spent in a facility taking care of you. I know someone that gave their daughter money to start a business, and they had to take her home because they couldn't afford to pay back the money that she had given them
It's
3 years earlier. So it can be heartbreaking, but um,
yeah. That's
and
so important for people to know that's how Medicaid works. It's a needs-based, cost-based program. And believe me, there are tons of bills and tons of people like me, and I'm sure Diane, who would make a ton of changes to the program and, get rid of a lot of things about it that are really prohibitive to people in these situations. But I always say, like, right now, I'm just telling you what the rules are. I'm not telling
yeah, right.
I'm not
That's it. This is
figuring out
not. It's not up
the
to
rules.
me.
I'm not telling you, that
Well,
that's for your congressman. You want to go yell at them, I'll join you. But right now,
yeah.
I'm telling you, they're gonna look back 5 years.
I was working. Another personal story. My brother was living in an assisted living, and he had a lot of conditions. And I was working on Medicaid for him. And I guess they thought, and they all knew me. I guess they thought that I knew a hitch some way.
Yes.
I didn't, but it took us forever, and they're supposed to have it done within 6 months. And you can go to the county website and find out what documentation they would need to submit that application. And they do tell you that if there's like $20,000 or less in assets to start submitting it, they don't if you're a spouse, they don't take your house. If you are a child that has been taken care, and now you can, adult child, taking care of mom for years, and that's where you lived, they also cannot take the house because that is your home and that's the expectation. You just can't move in. yesterday and say, this is mine. Yeah. But when you go, they do expect you. You do have to, if you're not there, you need to list it for fair market value. And if everybody passes away in that line, the husband, wife, the child, mother, whatever, they do expect to have themselves reimbursed because they have paid for your care. And long-term care is very expensive right now. What I say to people is when you're taking care of someone as a caregiver and you can no longer be the family because you're too busy checking on them and turning them and dressing them and feeding them and all those things, then it's time to hand that over to somebody else and let them be the family and you be bedside and take care of them. I mean, we've had so many caregivers that have had heart attacks from the stress. I can tell you a story of somebody that was taking care of someone and he came out of the shower and he fell on the towel rod that was ceramic and it impaled him. And his wife that had Alzheimer's panicked and ran out down the street, down New Road, just in a total blind panic. And he never thought of that. Like, who does he call? Does he need the life alert button?
Right.
Who's going to take care of her if he has to be hospitalized? So there's a lot of connotations with this. And like I said, it's the isolation. And then people tend to, if I'm a 24-hour caregiver and you say to me, what can I do for you? You're going to say, oh, we're all right, nothing. Somebody said to me, keep a pack of 3x5 cards in your handbag or in your pocket. And when somebody says that, pull one out randomly. If it says, bring lunch over or come weed my garden or like, because we all need something. And unless somebody asks something specifically, we go, no, we're okay. So it's like, it's like a sympathy card. When you say, I'm thinking of you, let me know what I can do. I'm never going to call you and tell you what you can do. If you showed up at dinner, I'd be happy.
Yeah, that's a great point.
Yeah.
Great point. I do need help. I just don't want to
Yeah.
I can't articulate it. I really don't have time to articulate it. And it changes on the daily. So just
Right.
do the nice thing.
Absolutely.
Yeah.
Absolutely. So that's it's one of the hardest things is to ask for help. And so many are, now there's so much divorce and nuclear families and there might be estrangement from children. And then the second wife ends up taking care of them and everybody has different ideas on what that should look like. And to have these conversations, and there are some really great resources out there. They tell you Thanksgiving is a great time to say, let's talk about, I'm digressing on to end of life, but let me talk about what I want my end to look like. No matter if I get dementia, if I get whatever. My mother blessed us all by saying, I won't live with any of you. So yeah. So when she was placed in assisted living, they had a dementia unit. We were blessed, but she took that guilt off of us. But how many people say, "Don't you send me to a home? Don't you get rid of me?" That's one of my favorites. Lock me up. Like you're not locked up, but there needs to be a realization. Because then I say to that child, "Would your mother want you to be going through this? If she knew what was going on, would she want you to do this?" And they usually say, yeah, no, that she wouldn't want that. Yeah. So it's again, and then, there's a physical disability that comes along with it besides the mental. And they say the difference is a normal aging process is me saying, I lost my glasses and I can't find them. And then me finding my glasses and saying, I don't know what to do with these. And there's, yeah. And there's signs like, mom could whip up that special dessert in 2 seconds. And then all of a sudden, mom, no, I'm not going to make that. Just go buy something because she can't remember.
Right.
So, and you don't realize that's what's going on. And a lot of people also hide it from their families because they feel embarrassed. And like if I said I had cancer, there would be 50 people with casseroles outside.
Right. Yeah. Yeah.
I say dementia and they run, what I can't talk to them. I can't stand to see them like that. You know how often we hear that?
Yes.
I can't stand to see them like that. Okay. And there's patterns. There's like with the Lewy bodies and with some of the frontal temporal, you get some paranoia. Some people get any type, there's an underlying mental illness that can exacerbate. And I just had one lady that her husband talked somebody in the family into taking him out and he bought her $150,000 car that she can't afford and he can't drive. So
wow.
yeah. So there's different things. And you know what? And support groups are a place where you can laugh and everybody's kind of in the same boat and it's okay. And it stays there. It's confidential. Right. We don't use names. We don't. And even if I saw them out in the community, I need to have your okay to say, like, this is how I know you. Stockton runs a great support group on Tuesday mornings. Half of it is virtual and it's education on maybe incontinence or mobility. And then the other half is true back and forth, not true, they're both support, but true back and forth support. And I have a lot of in my support group that go to both because they just need as much help as they can get. And when they tell family members, I need to go to support group, they're a little more willing to come over and help take care of them.
Right, right,
Yeah. If you say I
right.
want my hair done, they're going to say, yeah, no, see ya.
Yes, yes.
Yeah. Yeah.
Right. So that was going to be one of my other questions. So how can we as people who maybe know somebody going through this, who aren't going through it ourselves, but how can we actually be supportive? You talked a little bit about it with like, just do the nice thing. But what you said really spoke to me too about how if somebody has cancer, like the culture is so different. I hear that a lot from people who have mental loved ones with mental health disabilities. Like
Right.
if my kid has, bipolar or schizophrenia, nobody cares. But if my kid had cancer, they'd be
Oh,
at,
yeah.
at the door. So how can we actually, and it's just somebody with a disability with cerebral palsy. I know sometimes, like even something like cerebral palsy, people don't know how to just act like like not make the situation worse. So how do we like as outsiders have empathy, but also not pat a person on the head and be condescending and be helpful.
Well, first, in dealing with the person with that disability, and this goes over all the genres, and I think you're going to see that it's the body language.
Right.
It's getting on their level, not speaking above them and down to them if they're wheelchair bound or seated. It's a physical touch. It is all those things that goes through anybody going through anything, but you can watch people when there is that body language of acceptance and things like that. The other thing that people can do is get to learn people's routines before it's too late. So they tell you like to go into the bathroom with your loved one and watch, because you may get in the shower and wash your hair and then wash your body. I may wash my body and then wash my hair, or I may do my face first, or I might use a lot of soap or a little soap, or a little piece of toilet paper or a big piece of toilet paper. But they're the things that if somebody's trying to help you and they do it differently than you've done it all your life, you will get resistant.
So true.
Get resistant. Like you need to know that. I mean, I went to a conference, they put a roll of toilet paper and they said, take what you need. And we thought, what are they talking about? And he said, because, and if you grew up during depression times, you use one square if you were lucky. So that you do need to learn people's routines. You need to, and it just can't be one caregiver. There needs to be a lot of familiarity, and there needs to be somebody that's their safe haven. I think you're going to see this too against all genres, of someone to talk to with no judgment, of no, you go through the stages of death as before they're gone, because you've technically lost that person. So the anger and especially when it comes to the resources and the supports out there. The Mental Health Association, we did have a group that was meeting for caregivers of all disabilities. It got very elderly, top heavy, but and there's you can only be there for people. And then there's just nothing. It's not going to make this better. It's not going to make a chronic condition go away. But how do we do it the best? How do we help the person helping the person? Do they need help being fed? And then on that, there's a whole education that to properly feed someone that needs to be fed takes like 45 minutes. You can't just shove food in their mouth and walk away, or take the plate and mix it all together and shove it in. They're going to know that that's not right.
What you're saying is so just really speaks to me as somebody who has again not nowhere near the same thing, but it's so important as somebody who's had AIDS and had caregivers for them to still treat you like a person and not like act like you're not in the room and like just because you need help with this one thing that doesn't mean you don't notice when people are talking about you. Like you pick up on all that stuff and even like just respecting your routine and how you like things done. Like it's just so important because it just communicates that you're respecting me as a person and not just coming in and being like, well, I'm shoving this food in your mouth and this is what we're
Yeah,
doing. And it's like I think a lot of people sometimes think, well, they don't notice, they have a disability, whatever. And just
they
as
do.
somebody with a disability, I'm like, trust me, we all notice. Like we pick up on it, we notice. So assume we notice and just treating them like how you and I know it's hard and everybody likes to think they empathize, but it's really hard to really think like, you know, would I want to be fed like this? Like, would I want to be treated like this? It's just really asking yourself that stuff.
Well, even the professionals, I said there's times like, when you hear stories, oh, my call bell wasn't answered. You want to just strap somebody into bed and have them really have to go to the bathroom and see how that feels.
Right,
Like,
exactly.
yeah, you don't get into healthcare if you don't have the heart of healthcare. That's for
Yeah,
sure. And
yeah,
it is that everyday thing. And especially the number one reason people are put into nursing homes is when they become incontinent. And
right.
that people don't want to deal with that. Like, okay, it's incontinent. I know I'm a nurse, so it doesn't. Okay, it's incontinent. You know what I mean? It
My
is.
best friend's a nurse too. It's like you just roll with like you have no.
Yeah. You have no clue what I've seen, where I've been. Where like it's not a big deal, but especially when it's a parent and child, like we find a lot of males, the daughter's taking care of them, and when dad says, "Don't move me," they don't move them, and
Right,
then dad has bed sores. You know
right.
what I mean? Like sometimes you have to step back and make sure that the plan you have in place is appropriate for their overall well being and their care, just because that's, I mean, there's certain things you don't want them to have breakdown that leads to infections and things like that. The nutrition, a lot of times your taste goes also with Alzheimer's. And, if they want to have orange soda for every meal, okay. Yeah. What's the harm in that? If this is
Right.
I always tell everybody it's chocolate pudding for me. Just keep giving me chocolate pudding and right out of the can, and I'll be fine. Or take the boost tastes awful. Put some sugar in it. Put some ice cream in it, and whip that up, and take care of
Soda for me. I'll put that on the record on the podcast so
that.
people can look at
It's,
soda for me. Soda for me. So
yeah, it's well, that's we actually I worked on an oncology floor, and we had a little file box, and we all had the way we wanted to be treated. And it was like, I want my nails done, keep my underwear on. This is in the hospital. This is the radio station I went on. I want the chocolate pudding. But it's funny, and you don't realize you even want these things. So
that's so important. I think that's like so important. And so like there is caregiving is such a difficult thing, but there is a way to do it that I think is more dignified for the person.
Mhm,
And it's so
mhm.
important to keep that. And I'm not saying it's easy. I'm not saying
Yeah,
but I'm just saying like on somebody that's been on some degree of the other end of it as a person with a disability, like there is, there is a way that I wanted to be treated, and some people were awesome at it, and some people he did. So I'm like, okay, this isn't
right.
this isn't your thing. This isn't your thing. And the best people were actually the people who were humble and actually listened and actually didn't try to fix everything. Like those were, just being in school, those were, somebody who had a lot of AIDS and had a lot of that I need a lot of help with a lot of things. And the best people were the people who said, how do you like things done? Like this is what the instruction guide said, but I want to check with you, and is this accurate? Like those were the best people, not the people who came and tried to run everything and thought they knew better. You know,
Yeah. And that could be a mindset like, here, get in the shower. We gotta get stuff. Can you
yeah,
imagine being naked in front of somebody you don't know? All of a sudden,
yes,
there's
yes,
still that in your mind somewhere that it's inappropriate to be naked in front of strangers and they're
right,
gonna throw you underwater. Like,
right,
so,
yeah,
yeah.
exactly,
So,
exactly. You're just asking things like, are you comfortable with this? Just and by the way, that but just just communicating that tells me that this person is actually paying attention and listening. So it
mhm.
just sets the tone. Whereas when you come in and start trying to run everything, I remember thinking, "Oh, this is gonna be one of those aids.
Oh yeah. Oh yeah.
It's gonna be a long day for me. Like, it's gonna be a
Yeah.
long
And
day."
then even as a caregiver, I have one lovely lady tell me that she likes to do those word search books. And in fact, I gave her a whole bunch of them. And she said the caregiver was like picking them up and doing them, like overstepping their
Yeah,
bound. Like she's like, this guy's doing my books.
yeah,
I'll get you some more. But it is funny how there are different, and there's cultural differences
right.
between sometimes what we feel is needed and how we wanted to be treated. Do we, to be asked and to be, and even the mother is the maternal figure. And usually they're the best ones on giving the child a guilt complex and saying they
Yes,
didn't
yes,
do this, they didn't do that. It took them 3 hours to change my day. Like, okay, well, if they can remember that part of it.
right,
But yeah, so a good communication. The other thing a lot of people don't realize is if you are on Medicare, and I'm addressing this because a lot of it is an older issue.
right.
If you're on Medicare, that physician is paid additional money for once a year to have a longer visit with you. So when they try to rush you out the door, mm-mm, They are being paid by Medicare once a year to have a more in-depth, and at that time, they're supposed to speak to, I don't know if you've ever heard of a pulse physician order for life-sustaining treatment. And
What
what
is that? Explain that.
Okay, so we've all probably heard of an advance directive.
Right.
So it's a little bit more than an advance directive, and it is what they call portable. So an advance directive, if I'm with you and you have one that says don't resuscitate me, and I take you to the emergency room, guess what? They have to try to resuscitate you. A pulse, which people tell you to put on your refrigerator or copy in the glove box, is physician's order for life-sustaining treatment. I don't want this, I do want that. Because a doctor has discussed this at length with you prior to that, they do not have to do all those things. Because there's nothing worse than putting somebody on a ventilator and then realizing
Right.
this wasn't their wish and having to withdraw that when you see their chest still going up and down, but they're not there. So it goes over all the different things you want. I believe now that a nurse practitioner can also sign that. So, it's one thing that somebody should ask the doctor about that has a chronic condition, not only Alzheimer's, but any chronic condition. Again, the whole financial piece and a lot of these banks, you need to have their power of attorney. Like you can have a power of attorney, but then it needs to be submitted for approval. And I had a woman that he was online and he was just kept moving their money and putting it all over the place and things were bouncing left and right. And, then she had to take over all that. So even you need to have the conversation with them about a power of attorney, a living will, a pulsed. There's 5 documents that they say that everybody should have. In the state of New Jersey, if you are 18, you need to have a healthcare proxy. Your parents cannot make decisions for you.
Very important.
Yes, very important because nobody thinks of a young person needing that. And again, a lot of the hospitals don't challenge, like, here's mom, and there's not a wife, so or husband, so we're going to listen to her. But legally,
Right.
you need to have that paperwork.
I tell people that too. Like,
Yeah.
once your kid's 18, they're technically under the law. But
Hmm.
no, and I give parents and caregivers. I make all the decisions. I'm like, I know
Yeah.
you in practical everyday life make
Right.
the decisions, but I'm telling you, in the law,
Well, right. And I can't give you any information. Yeah. If they were so far gone, they couldn't give me a contact person in the hospital or any other facility. I can't give you legally. I can't give you any information.
right.
I do that a lot
And
of times.
like you said, it depends on, some hospitals will just roll with it and whatever, but you never know. That's why it's important to
Mhm.
have the actual documentation and to really think about this stuff. And I know it's something that people don't want to do the planning because they don't want to think about it, but
Right.
it's
And
better
and
to
to
have the stuff.
sin we've gotten like that. I mean, like I said, I've been a nurse and in this industry for a long time, so my kids know, like, I don't want to be resuscitated. If 2 doctors tell you I'm gone, like, don't worry about it. It's done. Yeah, you can give me a couple of cardiac meds, and there's unrealistic expectations of what medicine can do. So, and a lot of it is spiritual and what you think spiritually. Like I say, if God could solve it, then let's keep going. But if He can't, we're done. That's my own belief.
I
So, and
agree.
I've had people, one of the first patients I assessed when I was an admissions nurse was a woman that clutched a stuffed animal under her arm. And the family would not take her off a ventilator because that arm being bent meant that she had a quality of life. And that woman laid in that bed, knew no one, had no reactions, was because she could put her arm around a stuffed animal that they put in the crook of her arm.
Mm.
They thought that was a quality of life. So there's all those, there are and it should be an easier conversation. There's a lot of conversation cards. There's actually something called the death deck that's out there you can buy on Amazon that you can just ask these questions. They're like conversation starters. They say like when everybody's together like at Thanksgiving, so that it's not one child. My brother believed that my mom wanted to be cremated, and he believed that she needed to be buried next to my father. My mother never wrote that down.
Right.
It needs to be a conversation. So she was buried, but it needs to be a conversation. And a lot of people just say, "Well, I don't care. I'll be dead. So whatever." I'm like, well, how do we get from disability to dead? But
Yeah.
that's yeah. I guess I got off the track. I can go on forever about a lot of things. I've been doing this a long time.
No, I mean, this has been a
Yeah.
great conversation, and we talked about, Alzheimer's, dementia, caregiving etiquette. Like, I think we've
Mhm.
covered just a lot of topics
Mhm.
and a lot of people, and it's really been a different topic in the disability world than we've had in your episode 41, and this has covered a lot of things
Yeah.
that
Yeah,
that
I really appreciate this. And there is so much more. And I encourage everybody to get educated. You're never going to go by facilities and say, here, let me drop off my loved one and push them out the door. Like, get to know places. If they have social events that the community can go to, please get to know their staff, get to know the feeling of the place, get to know a little bit more because it's usually a crisis situation that people have to make decisions.
right. Well, I always say that in our disability world, people call us in the crisis, and
Yeah.
that's what makes it difficult. It's much more easier to get people resources who have done planning and have gotten things set up and
Mhm.
have done their own research. Like that's much easier. And I know it's look, we're all human. Like we're
Yeah.
human. We're just trying to get through the day
Right. Right.
sometimes. And I'm
Yeah.
like, now I gotta play the
Yeah.
death game, and I'm just trying to have Thanksgiving. But like that's that preparation is what makes life can make hard things a little easier. And when you're dealing with something like this that is really hard, a little
Mhm.
easier is counts for a lot. Like I always say that a little better is a little better. Like it's
Yep. Yeah, anything you
right.
can do, and although we can't stop it at this point, and then we do encourage everybody, the Alzheimer's Association is having their big walk on the Ocean City Boardwalk, October 26th. I'm walking with my 6-year-old granddaughter because my mom had dementia, and she's named after her backwards. My mom is Elizabeth Josephine, she's Josephine Elizabeth. And she years ago carried the white flower, and there's different flowers for different things with the walk. And like, remembering someone with dementia, you have dementia. The white represents the cure and the hope for the cure. So they always allow the children, the small children, to carry the white flower that we hope that there's a cure. So I encourage everybody to come on out and take a walk, go on that website. I'll send you some of the resources that I know of. And there is a local Alzheimer's chapter here in Northfield run by Mary Beth Lewis, who's awesome. There's memory cafes over at the JCC. There's stuff at Wesley Manor. There's stuff all over. And at least to share your experiences, and somebody else might have a good idea on how to help what you're dealing with. So that's what we aim for here.
Yeah, I think that's awesome. And we'll, because I know I'm going to get questions about this, maybe we'll end it by what is the status of things like cures and medicine? And I know I like what you said too. Me and you are very much the same vibe. People put sometimes unrealistic expectation on medicine and cures, but kind of give people, if you can, where we are in reality. I know I read an article about
They
Alzheimer's treatment that was approved, and then there was kind of some back and forth about that, but kind of talk about that stuff.
Yeah, so there is a new drug. I can't remember the name of it, to be
Me
honest with you.
either.
It was just approved, and if anybody knew what it takes for a drug to go through a clinical trial, technically, back in the old days before we needed things this quickly, like the pandemic, it was almost 20 years, and there only has to be a couple failures, and that drug is pulled.
Yeah,
So I've had people that have been in trials, have been in them for years, and all of a sudden the drug is getting ready to be approved, and it's pulled. What was said to me, my mother was on the original round was Aricept and vitamin E, is that a lot of these drugs are for the caregivers. You don't know if they're working because it doesn't
right,
make them better. It's supposed to stop the progression. Well, we don't know what the progression was going to be.
right, right,
So, and then a lot of them are for behaviors, like if they need to sleep, sometimes they have the opposite reaction of what it's meant for. If they get agitated, if they, just to calm people down, because again, a lot of them know that something's not right.
right.
So you need to really have a good physician trained in dementia and Alzheimer's, a neurologist preferably. I mean, they can do head scans. They can see that there's, white matter in the brain. There is some genes that they're saying you can look at, but would you want to know if you have it before you
Right,
exhibit signs? I don't know.
right. How does that impact
Yeah,
function?
like how would you change your life? You should already have those pieces in place, whether it be Alzheimer's or a car accident or any type of
And maybe it'll make you change your life in a negative way because psychologically it could mess with you. Like I'm not gonna
yeah.
live my life to the fullest because you
Yeah.
know.
Yeah. No. So that is, we should be living our life that way anyway.
Yeah.
So that's a very hard judgment. But there are all kinds of work going on. There is an advocacy program through the Alzheimer's Association. They just got a lot of money approved, and obviously not enough. It's because it's what people consider an end of life disease. They're old. They're gonna die anyway. Yeah.
Not the up that is,
Yeah.
you can hear some politicians
Yeah.
saying that.
Oh,
But
yeah,
everybody,
certainly one that's been on the news lately,
yeah,
but
yeah,
I think
yeah,
that was inappropriate of me, but it's the
yeah,
truth. Yeah. So it's we can be there for each other, and we all are a community, and we all got so isolated during the pandemic, and it is time the doors are opening up again, and there's things to open up, and also be aware of what your loved one likes, because a lot of times responses to music and appropriate music. Don't put on Glenn Miller, who was in the 40s, because now I think that was 80 some years ago, so they weren't 20 listening to Glenn Miller. Put on your 60s music. But a lot of times music can bring around art like paintbrush and sometimes you have to put a hand over hand and help them guide and talk to them about what they're painting.
Right.
But there are different things. Kind of go back to, what did they like to do when they were younger? Did they like to sing? Did they like to dance? Did they like to, I don't know, if they go for a walk, then go for a walk. Just don't leave them. Don't leave them
Yeah,
somewhere.
I
Yeah.
just hear you saying that there is progress being made. It's slow, but also
Hmm.
be keep your foot on, try your best to keep your feet on the ground about it.
Yes. Yeah.
And nothing excuses. Nothing is going to replace right now doing those basic things and preparing of treating somebody
Right.
well, of those little things
Mhm.
altogether count more. So we were worried about this being too short, and
Well,
now
I know. Can you believe it? But
on
thank you. You're
I knew we
amazing.
could get started. So thank you so much. It's been a
Thank
great
you.
conversation. And thank you everybody for listening. See you next
Thank
time
you.
on the
Take care.
Atlantic
Bye
Podcast.
bye.
Bye.